College of Medicine is championing social prescribing as a way of harnessing community resources to improve health and well-being, as well as reducing the strain on healthcare providers. Robin Ross spoke to some of those at the forefront of social prescription, as well as those who have benefited from this alternative approach to treatment.
Maria and Francis have been together for 6 years. Their love blossomed at a gardening class prescribed to help them take control of their health problems. Maria is epileptic and Francis suffers from mental health issues, asthma and depression. Before attending the social classes, they both felt lost.
Yeah, I actually found something when I wasn't looking for it. You know, it just came to me.
You feel as if that you have more control over what you do?
Yeah.
And how does that feel?
Quite good, actually.
They attended various social classes at the Bromley Bibo Centre in London. A doctor refers patients here. They are then given their very own personal health trainer who finds the right programme to help make them better, such as healthy eating, exercise or debt counselling. It's called social prescribing.
And what tends to happen is we have a very busy, very high kind of volume health system that moves people on and on and on, and we don't have the time to really understand what people themselves want. So social prescribing brings that time into the system. It makes time to really help individuals understand what they need to help them in their lives.
In the heart of London, leading health professionals have come together to discuss sustainable healthcare at a conference organised by the College of Medicine. Social prescribing is a hot topic.
There are 8 CCGs that are offering it to every patient and every GP. 49% of CCGs are involved in some way. That means 50% of the country isn't. But bit by bit, we're trying to give it credibility, explain why it's important, and the hope is that one day every GP and every patient will be able to access a social prescription.
Historically, doctors have given patients prescriptions as part of treating disease. Social prescription gives them the opportunity to tackle some of the underlying causes of them becoming unwell in the first place. A fifth of a GP's time is spent dealing with patients' social problems. Dr. Guy Pilkington is leading the way in social prescribing.
I've seen a change in individuals' sense of value and their self-esteem, and if we can support people to believe that they are worth something, then they become capable of achieving amazing things.
Broadcaster Carrie Grant represents the views of patients. She has Crohn's disease and her 4 children are special needs.
There's a lot that we could be doing with patients that we're not using their gifts and skills. So when I go to see my consultant, does he just see Crohn's disease and a poor victim who's not doing very well and should be told what to do? Or does he see a woman that runs a business, that has 4 children, that runs a home, has done lots of successful things in my life? So therefore, actually, even though I have Crohn's disease, I also have lots of skills within my skill set that quite possibly could be used to help my health.
It's a growing movement. There is a social prescribing network sharing knowledge and best practice to inform good quality research and evaluation.
NICE would very happily look at social prescribing and the benefits of that if we were asked to, and I think it might be quite a good way of evaluating the impact of it, and then it might encourage it to be rolled out should NICE recommend it in the future.
Social prescribing is seen as part of the future of healthcare, but the question is, can it save the NHS?
It can save the NHS. It makes the health service sustainable because we know in the CCGs that are taking it on, it saves money within a year or 2 and an awful lot of money thereafter because patients aren't using the health service quite as much as they were.
And word is spreading. The Bromley Bibo Centre has an international reputation.
So a lot of healthcare professionals or healthcare leaders, the social sector, come and visit the centre from all around the country and all around the world to actually look at how you can break down some of the silos between the different support that people need.
Francis and Maria now volunteer at the centre helping others, so you don't just help that one person, you also help the whole community.